The Congressional Budget Office released their analysis of the Senate's version of Trumpcare, and it's bad. It's very, very bad. The U.S. Senate bill overhauling Obamacare would result in 22 million fewer Americans with health insurance by 2026 and $772 billion less in Medicaid spending if it becomes law, according to a heavily anticipated estimate from the Congressional Budget Office. The Non-Partisan analyst tasked with understanding the impact of major legislation also said the bill would remove 15 million additional people from the insurance rolls in 2018 alone. It is expected to cut the federal deficit by $321 billion over a decade. So, when it came to the House version of Trumpcare, the number was 23 million fewer Americans with health insurance, which I believe would bring the total number of Americans without health insurance by the year 2026 to 53 million people. Under this bill, the Senate is usually where legislation from the House goes to become more moderate and get watered down. That's how much more moderate it became. It went from 23 million fewer Americans with health insurance to 22 million. So, wow. Don't go too far to the left there, guys. Goodness. And the Medicaid cuts were $880 billion in the House bill. Under the Senate bill, it's $772 billion. Unbelievable. So I have some more facts about this. Check this out. According to the CBO, premiums for a 64-year-old with middle income go from $6,800 under the Affordable Care Act, which is still way too much, by the way, to $20,500 under the Republican bill. So people who need care the most, you know, when you're getting up there in age, 64-year-old, that's just before you hit the Medicaid age, people right there in that sweet spot where they're going to need care the most, their premiums go from $6,800 under Obamacare to $20,500 under Trumpcare. The bill's a joke, man. And then also, get this fact, this one just blows my mind. The tax cuts that 400 families, the richest 400 families, are going to get under Trumpcare equals the Medicaid expansion for 700,000 people. So remember, under this legislation, they're axing the Medicaid expansion. No more Medicaid expansion. The Medicaid expansion applied to people up to 133% of the poverty line. So if you made about $28,000 a year or less, you would qualify for Medicaid under Obamacare. They're axing the Medicaid expansion. And under the bill, the tax cuts that the richest 400 families receive, if we didn't give them those tax cuts, that money could be used to cover 700,000 people, give 700,000 people health care. Is there anybody who could defend this when you look at the facts, when you look at the merits? There's no way. Because the bill is simply crafted to be a giveaway to the rich and be a giveaway to the private health insurance companies. You know, Obamacare was bad enough because it was a massively watered-down piece of legislation. It was originally a right-wing plan, but that's what we got. But it was at least a step in the right direction. Under Trumpcare, this is just the absolute, utter destruction of the American healthcare system. Again, Obamacare is bad enough. The real answer is Medicare for all. But this is just, it's like a joke. It's like they're playing a sick joke on you. Oh yeah, I got one more fact for you. Under a new study that was just released, there would be an extra 28,000 people that die every year if Trumpcare were to be in place. So we already have thousands of people that die because they don't have access to basic health care. 45,000 according to a Harvard study. Under Trumpcare, add another 28,000 to the 45,000. Look, this is what happens when your political spectrum is all screwed up. So in the U.S., the Republicans have moved to the right, and the Democrats have followed them. So now the Democrats act like what used to be described as a moderate Republican, and the Republicans act like they're in a mental institution. They're authoritarian corporatists through and through, to the point where they barely try to conceal it anymore. Remember, saying that Obamacare was a right-wing idea, it's not an opinion, that's just a fact. I mean, this is the kind of legislation that Richard Nixon proposed. That's the kind of legislation that Bob Dole was in favor of. That's what Mitt Romney put into place in Massachusetts. The Heritage Foundation, which is a right-wing think tank, wrote policy papers about how their answer, the right-wing answer to Medicare for All, is an individual mandate system where you make a rule that people have to buy insurance on the private market. So that's just what it is. It just is a right-wing reform. So when the Democrats adopt the old Republican position, the Republicans said, we got to move further right. And what's further right? Some sort of bill that Genghis Khan would have created. And that's what the results are here. And thankfully, there's a lot of outrage over this. There's already been, I think, 3 Republicans who've come out against this bill. So, I mean, knock on wood, let's hope that this thing is dead in the water. Though I don't know if it is, to be sure. But it better be, because this is a horrendous piece of legislation. And remember, the very similar House bill, the Trumpcare version in the House, that had an approval rating of a whopping 17%. So you know how they always bitch about Obamacare? Oh my God, Obamacare is unpopular, shoved down the throats of the American people. Yeah, Obamacare, depending on what time you look at it, because sometimes it had like a 51 or 52% approval rating overall. But when it's unpopular, it has like a 46% approval rating. And the Republicans are like, American people hate it, we got to get rid of it. Your bill has a 17% approval rating. They're like, yeah, no, we don't care about that. We're going to shove this one down everybody's throats. And remember, with Obamacare, that fact is a little misleading, because virtually all of the provisions, when you get into the specifics of Obamacare, virtually all of the provisions except the individual mandate are overwhelmingly popular. So, and remember, under this bill, too, there's waivers for protecting people with pre-existing conditions. So the states can say, we don't want to protect people with pre-existing conditions, and they don't have to under this bill. And there's a million other waivers as well that they could just opt out of. Under Obamacare, at least 80% of the money that insurance companies have and that they take in needs to go towards actual health care, and only 20% can be used for overhead. Under this bill, that's now optional also. The states can opt out of, hey, we don't want to have a ratio where 80% of the health insurance money has to go to care. So you couldn't bias a bill more in favor of the rich and the corporations and the private health insurance companies and big pharma. That's what we see right here. And frankly, it's a joke. So I hope it gets defeated resoundingly.